My name is Joshua Bittler. I'm the Assistant Director of Transfer Admissions here. I work with a lot of our nursing students. And with me today is Dr. Terry Peach, our Associate Dean of Nursing, and she'll be taking things away.
Great. Thank you, Joshua. Well, welcome everybody. It's really great to know that you're on the line with me. This session is really for you and your ability to ask questions. I thought that it might be helpful to kind of ground us though for just maybe 5 minutes, kind of just go through a little review about Newman's Nursing. So I'm going to go ahead and bring some PowerPoints up. So just give me a second to do that. Nah, it's telling me I can't. That's okay. I'll just go ahead and talk through it, all right? Yeah, thanks. It's all right. We make do when we have some technical issues, as long as we get the content across. So we're fine. So, so Newman Nursing is uniquely different. And what makes it so uniquely different is that we frame our program around the Franciscan tradition and under our mission of Rises. So what I mean by that is we have a liberal arts program that embeds nursing in it. And the Franciscan tradition allows us to balance our liberal arts education with the science of nursing. So nursing is a science, and the science allows us then to give high quality care to our patients. As we have our students go through our curriculum, we believe very firmly in imparting our Franciscan values, and those are the rises, the reverence, the integrity, the service, the excellence, and the stewardship. And the reason why we do all our curriculum in this format is we are totally committed to that nurse when they graduate, that they are committed to maintaining the highest dignity possible for their patients, that they are practicing morally and ethically, that they have the ethical stance to take care of patients with compassion, that the high level of clinical education is there, and that we engage in lifelong learning. And here's the reality. We have seen this play out over and over again as we've experienced this pandemic. We can see and experience the importance of the nurse for patients. And so what a blessing for people that want to become nurses. It is just a wonderful, wonderful career. And to come to nursing, we truly embed these values that are just so critical to nursing. Why nursing at Newman, though, is somewhat different. So a couple of just really important pieces. The one that stands out to me the most is that we have full-time faculty, and all of our full-time faculty are the teachers in the classroom. So you might be thinking, okay, well, that's nice. But the beauty of that is our full-time faculty understand, are engaged, and want to move our nursing curriculum forward, so that there's not different faculty jumping in and out of courses. There's a core group of us. There's around 16 to 17 of us that are the core faculty. And I also teach in the program, which is wonderful for me because that way I can still touch with students as well as do some of the administrative work. So the student-faculty partnership at Newman is unique. You don't see that in a lot of the nursing programs. The partnership, though, for the freshmen is really important. So I just want to re-mention this. If you had come to any previous sessions in the fall, you would have heard about this. I just want to touch base with this again real quickly. As a freshman coming into Newman, there is a transition course, and we have nursing faculty that are teaching those transition courses. It's a 1-credit course, and that's to start to engage in nursing and the nursing philosophy. So nursing faculty are teaching those. We have academic and professional guidance. All of us, including our dean, Dean Kathleen Hoover, and myself, and the faculty, we all advise students. This is really a really wonderful service that we offer. We have nurse tutoring. It's done by a doctoral prepared nurse. And even as we move to online over the last 5 weeks now, we're doing nurse tutoring, student nurse tutoring for our students with Dr. Marion Ward, and we're having it done through a process just like this. So even though we're not on campus right now, we've not lost that. We also have a program that's called the PASS program. The PASS program stands for Program Partnership with Academic Success for Students. And that is a program where So any student can join. We encourage students to join, and students can work in small groups with one of our clinical experts, Mrs. Sheila Keller. She's our simulation coordinator. They can meet weekly with her, and she reviews content that was given in class. Then students also have access to a educator who helps students with study skills, because that transition to college can be big for students. So we have that as a partnership, and we're very, very proud of that. Within our lab settings and within our clinical settings, we have a ratio of 1 faculty to 8. In our classrooms, we do have bigger size classrooms. So I'll just speak to my own courses I'm in right now. I am teaching mental health nursing, and I have 39 students. When my students go to clinical, and yes, we are going to clinical right now through a virtual simulation, there's a 1 faculty to 8 ratio. A couple other things I just wanted to touch base with you on, just to make sure we're all clear about this. When you come to Newman as a freshman, you come in as an intended student, meaning that it is your plan to go ahead and declare nursing as your major in your sophomore year. And that happens generally if you stay on track with the academics and you meet all the requirements. That happens in your sophomore year, 2nd semester. One point I do want to make about that, if we were to have 100 students be successful, which is what we want, all 100 students would move forward. And my point in saying that is we don't have a cap. We don't say, well, we only take 40 students or we only take 60 students. A student that has come to us is tracking to becoming into the nursing major. If they meet all the academic requirements, they will come into the program. And I think that also makes us unique in that respect. I just want to briefly mention this. So as you, I'm sure, are well aware, we needed to go to online. And so I'm thinking some of the questions might be, gosh, I wonder what they did with clinical. And so what we did with clinical, we went to virtual simulation. And we partnered with one of the publishers to bring that to our students. And just yesterday, I was in clinical with some students, and we were taking care of patients that had bipolar disorder and also a patient that was severely depressed. In our senior classes, our senior students are getting ready to graduate. They're taking care of very highly acute med-surg through a virtual simulation. Doing anything from taking an intake assessment information to going ahead and reviewing orders and then doing the administration of orders, looking at the evaluation process. So it's really been an exciting time for us to be able to still meet our student needs. So that was kind of what I was going to have in my PowerPoint. So I've said a lot at this point. So I'm going to go ahead and open it up to questions, because really this is your time to ask questions of us.
All right, everyone. So if you have any questions, you can type in the box, you can hit the raise the hand feature, I can unmute you. My ultimate goal is to become a doctor of nursing and to teach nursing as a professor. What would that journey be like?
Wow, what a great question. That's a really great question, Allison. So the journey to becoming a professor and to receive a doctorate in nursing practice has to start with first becoming a registered nurse. And so the best entry into practice at this point in the United States is actually to receive a Bachelor's of Science in Nursing. And so at Neumann, that's what we offer. So once you get your Bachelor of Science in Nursing, then you have the ability to sit for the licensing exam and you become officially a registered nurse. Now, depending on your journey, there are programs that actually would allow you to go right from a Bachelor's of Science in Nursing all the way through to a doctorate program. There are many people, though, that become professors that provide care at the bedside, learn those skills, learn the nuances of taking care of patients, learn about their passion. So my passion when I actually first got out of school was critical care nursing. But as my journey evolved for myself, I wound up being a professor. That wasn't in my goals at first. So the beauty of being a nurse, a registered nurse, is you can go off into different avenues. So let's just say, Allison, you had a thought that you wanted to take care of pediatric patients. And so you might then go forth and get your master's in nursing science. And then after you achieve that goal, then you would move to a doctorate program. Now, there are programs that allow you to have a Bachelor's of Science in Nursing and go right to a DNP. The total journey, if you were to do it seamlessly, if you were to go from the Bachelor's of Science in Nursing all the way up to the DNP, probably would be somewhere between a 7-year journey. 4 years to get your Bachelor's of Science in Nursing, and then about 2 to 3 years to get that doctorate degree. So I hope that answered your questions. Do you have any follow-up questions on that, Allison?
Follow-up questions, or anybody else with some additional? And in the meantime, as maybe a couple questions come through, I might ask a couple for you as well. One question I would love to know from you is, what is your favorite part of working at Newman University and being part of the nursing department?
That's a great question. So my favorite part is the energy and the engagement of the faculty and the students. It really is. And so we've had this transition, and many of us often say the same thing. One of the things we miss the most is actually seeing our students on the campus. And so we see our students right now through Zoom or through our Blackboard learning management system. It's the same concept, but it's different for us than being able to have that one-on-one type of engagement face-to-face. So we're making do with it. I think we've done really an outstanding job with making our transition, but really our favorite part is the engagement and the energy. And there's nothing like nurse pitting and graduation when we see those proud graduate nurses walking across that stage, knowing that they're going to sit for their nursing license and then become nurses. And usually in the first year, a lot of our students who are now registered nurses will come back and talk to us about their experience, which is wonderful. In fact, we like that so much. In one of our courses, Professionalism in Nursing, which is a 400 level course, we often invite alumni back to talk about that first year of being out in nursing practice. So I would say, Josh, that is my favorite part. It's the engagement and the energy.
Very good. So we did have a couple questions roll in. First off, from Allison, we do have a follow-up. She does say thank you for your helpful answer. She also wants to be an L&D nurse straight after graduating. Is that a difficult specialty?
That's a great question. So labor and delivery nurses. We have a lot of our students that get residencies in the tri-state area. A residency program is a nurse residency program. When you graduate, you get employed by the hospital, and they allow you to go into specialty units. So right now we're seeing a lot of nurse residency programs in the intensive care unit. I'm not aware right now of anybody that is having a nurse go directly into labor and delivery, but by the time you graduate, that could change again. So what we typically see is based on the nursing employment in the area, and if there's a nursing shortage in a specialty area, it's more likely that a graduate nurse can become hired into a specialty like labor and delivery. Having said that though, about 2 years ago, one of our nursing students who graduated was hired into maternity, and in 2 years she's actually working in labor and delivery.
Okay, and next we have Sandra. She's asking, is a DNP and a PhD the same thing?
Okay, that's a great question, Sandra. So a DNP is a doctorate in nursing practice, and a PhD is a philosophy degree, and they are different, and they differ based off of education, and then they differ off of the focus. So let me just talk about the PhD first. So the PhD in nursing is generally someone who is looking more into taking a track through research. They want to have their career be in research, whether it's nursing research or an interprofessional type of research. The doctorate in nursing practice is commonly seen with people staying at I'm going to refer to it as the bedside, but caring for patients directly. So a DNP is common with someone who's went out and earned a nurse practitioner license, or it could be an educator. On our faculty right now, we have 2 faculty members that have doctorate in nursing practice, and that one would be Dr. Marion Ward, who is also a nurse practitioner and is our tutor, and then Dr. Michelle Santana, who teaches in our synthesis course. So both those individuals have doctorates in nursing practice, DNPs. And then someone like myself has a PhD. A PhD takes a little bit longer to earn than a DNP. Both very, very valuable to our profession now.
Wonderful. Now we have two questions I'm going to combine, one from Daniela and one from Phoenix, and they're both related to clinicals. So in a two-part question, what year does Newman allow students to work in clinicals? And second part would be, how many clinical hours does a student need?
Great question also. All right, so what happens with the nursing curriculum is when you become in the nursing major, which is Nursing 206, that class focuses on assessment skills. So the picture that we're looking at up on the screen, for instance, those are two of our now graduates that were in the program, and they're practicing their assessment skills. And that happens in the laboratory settings. That's what that picture actually is in the lab. Junior year, first semester, all the way through senior year, last semester, so it's 4 total semesters, our students go to clinical. And we start our clinical in the junior year, first semester. Students either go to medical surgical clinical, or they do mental health clinical. They do it for half a semester, and then it flips, so that if you did mental health first, then you turn around and you do med surg. So it's junior year, first semester is where it starts. Now, I'm not sure, I think you asked me 2 questions, right?
Yes, the second one was just related to the hours. So how many clinical hours does a student need?
So each course has requirements for total hours. In general, it's 84 hours. So we have split out our theory and our clinical. So our theory courses, for instance, are Nursing 305, which is junior year, first semester. Theory is 2 credits. And the clinical is 2 credits. And those 2 credits is a total of 84 hours. And we go, our clinical sites, we go across the tri-state area. Right now, though, we're not in New Jersey at all, but we do most of our clinicals in either Pennsylvania or Delaware is where we are. And it could be Philadelphia, it could be out on the main line, or it could be down, for instance, at Christiana Health System. Josh, I remember a question, and I don't think I answered it. Someone had asked about 205.
Yes, I was getting to that one. Right before that, there was one about possibly a Facebook page of nursing specific students for incoming Newman students to connect and possibly find a nursing roommate. Now, to my knowledge, I know typically the incoming class does make their own Facebook page. I'm not 100% sure that they've made the nursing specific group. I'm not sure if you've heard anything different from your students. Not
that I'm aware of. We did have a Facebook page, but it was more around Student Nurses Association. And I think this question was more specific to...
Yeah, so my best recommendation was typically there should be a new incoming class page that it is made and you can find, and then I would probably inquire within that to connect with some other nurses that are coming in for that year.
Right, because I know a lot of nursing students do in the freshman year, if they have roommates that are nursing, so there is a mechanism in place. So even if we need to follow up with you on that, we can certainly do that.
And then yes, getting to the next 205 question, Kendra asks, what type of things do we learn in our first Nursing 205 class?
It's a good question. So I'm going to give you 2 answers. I'm going to give you what we're currently doing and what our plan is. So currently it's a 3-credit theory class, and there's a lot of really exciting information in there, such as complementary and alternative medicine, introduction to what the nursing profession is, what a profession is, expectations around ethics in nursing, spirituality in nursing, some key concepts around the history of nursing, The history of nursing actually we were required to do by the State Board of Nursing, but that's kind of fun too because we learn about Florence Nightingale, who is our leader in nursing. So that's what we're currently doing. We're going to be doing some revisions in that course, and the revisions will either go in this year or they'll probably go in the following year. And we're going to just change our focus slightly to talk more or focus more on critical thinking. How do we think as a nurse? How do we make judgments as a nurse? And we believe that's an important piece to put into that 205 class for students that are going to be going into the major. But it will still remain a theory class. So that's 205, and at 205, you're still an intended major at that point. It's nursing 206, which is health assessment and modalities, where you become an official nursing major. And there's an application process for that.
Looks like we have two more. Kendra has a follow-up as well. It says, what kind of different traveling opportunities are available to a nursing major, nursing profession?
Wow, that's great. Okay, so there's a couple of things. We have some nursing majors right now who were studying abroad, and they were doing that between their freshman and their sophomore year. So it's a little bit difficult to travel abroad once you are in the major because there's such a commitment to the clinical work. So for students who really want to have that travel abroad experience, we're seeing students plan that out early on and doing that between freshman and sophomore year. But we have been very fortunate. Our community nursing professor, Dr. Amy Lukowski, has led for at least the last 3 years a clinical group. She's taken students to the Dominican Republic. And in fact, the students returned right before COVID-19 hit the United States, where travel restrictions happened. So in Nursing 440, which is community health nursing, students are given the opportunity, it's an application process. Instead of doing community nursing here in the tri-state area, students can participate with Dr. Amy Lukowski, and they do an immersion down in the Dominican Republic. And that is there's some coursework before you go. Students are down in the Dominican Republic with Dr. Lukowski and a mission group for, I think it's 7 to 8 days, and then they return and some work afterwards. And students really enjoy that. That's a real highlight for many, many students.
Okay, we have one from Danya. It says, during summers, or for the summer, can I take science courses at a community college to get ahead?
So we do have students transferring in credits, all different types of credits. And so a couple of things that are really important if you take credits outside of Neumann is you want to make sure whatever course you're looking at, that you get pre-approval through the registrar's office, because you wouldn't want to be in a position where you took a course and you think, oh, well, that will apply for the bio course. And so that's a relatively easy process to go through. The registrar's office helps all the time with that. And, someone from nursing or the advisor can also help with that. And students do that. They'll take perhaps 1 or 2 courses ahead of time, or they'll take it at the end of their freshman year. The important piece to know, though, it's very important that there are 4 science courses that we look at the first grade that you earn. It's the first grade that you earn. So if you're going to be thinking about that, you want to plan out, will the credits be a match to what we require? And then am I academically set to take the course and feel that I can be successful? Because that first grade in whatever science course will count toward the quality points for your nursing major.
And I would also recommend making an appointment with me as well to discuss these, since I work with our transfer students coming in. Okay, a couple more questions. I think we have a couple more minutes here. Jack asks, can you speak more on the application to the nursing program sophomore year and what's required to be accepted?
Great question, Jack. Thanks for that. Absolutely. So the most important piece is to stay with the curriculum. So I'm just going to flip to a second so I make sure I'm giving you the information. It was on my PowerPoint, but that's okay. So what's really important is that you have a GPA, that you maintain a GPA, and that you have in your allied required courses at minimum of a C. And then there's these 4 science courses: chemistry, anatomy and physiology 1, anatomy and physiology 2, and microbiology. And we look at them as a group. And currently in the program, we have freshmen this year, and they are required to have what's referred to as 40 quality points. The other way to think about it, when you take those 4 courses, so again, it's chemistry, anatomy and physiology 1, anatomy and physiology 2, and microbiology. When you average those together, you have to come back with a minimum of a 2.5, and everything has to be at least a C. So that's an important piece also. And then Nursing 205, which is a pre-nursing course. That was that question I was answering a little bit earlier. You would have to also get a C on that. So you have to stay on track. You have to have the minimum GPA. And then these 4 science courses, when you put the 4 together, you average the grades together, it's a 2.5. That was a lot of information I just put out, so I'm hoping I get some questions for clarification on that.
Of course. Okay, moving down the list, Samira asks, my major is undecided. I was wondering, would I be able to switch to nursing once a Newman student?
Okay, and we do see that. And so we have students sometimes that come in undecided, and then they realize, for whatever reason, perhaps it's their roommates, perhaps it's their exposure at Neumann, they say, no, I really want to do nursing. And so we do accept students that come in. I will say, though, that sometimes it takes a little bit longer if you do it that way. However, if you are kind of thinking about that, whoever your advisor is, and Joshua, I don't know if you'll speak more to this, it would be important to start to try to build the initial courses to try to match into nursing as so there's not a lot of lost time.
Of course. Yeah, kind of going on what you said, just if this is something that you would be considering and you know that already, as you enter as an undecided student, please make sure that you discuss this, at least voice it a little bit with your academic advisor so that they can gear you to those correct courses, to make sure that you wouldn't lose any time and you're on the right track. Are the academic resources available for students that need help with any schoolwork?
Academic resources, I'm sorry, I just lost the last word. Help with?
So Danielle asks, is academic resources available for students that need help with their schoolwork?
Yes. Yes, so there's the university academic resources, and then there's the nursing program academic resources. The university has a beautiful site in the Bachman building where there is tutors, there is writing services, there is study services, and that's available to all students. And then nursing has, once you're in the major, nursing has additional services, which would include the tutoring. And the tutoring could be Dr. Ward, or it could be like myself in my class. I tutor with students also in the class, usually in small groups. My colleague, Professor Lutz, would do the same thing. And then you have access to our education specialist for any nursing student who's feeling like I'm having difficulty figuring out what's important in nursing. And our academic specialist, Pat Simpson, works with students specifically about study skills. So it's 2 ways, the university and then specific to nursing. I think we really pride ourselves on our academic support services. We really do a nice job with it.
All right, the next question would be, Jack asked, what would you say is the most demanding class for nursing students?
That's a really interesting question, and I'm kind of sitting and thinking about it and reflecting on it. So sometimes you think a student will struggle more with one course or the other, and then you will have 5 students who are like, boy, I'm really struggling, Dr. Peach, with that course you're teaching, which might be, for instance, nursing research. And then I might have other students who are like, I got this. So I don't know if it's a course specific, but sometimes it's more semester specific. So let me just address that. So in my experience, we see students in junior year, where now they are, not only doing academics, but they are doing clinical. That's what I refer to as a big step up. And why is that? So some of it is the reality of having to get up early in the morning and going to a clinical day. And some of our clinical days are 10 hours. And, for an experienced nurse, going to work for 10 hours may not be as exhausting. But for a student, who is learning how to become a nurse and has to manage all these different stimuli coming at them, it can be exhausting. So we actually find junior year, first semester, and a lot of students will say this. If I had students with me today, I think they would probably agree. That's one of the more challenging semesters. So at that point, students are now taking 2 nursing courses, theory courses, and they're taking 2 clinical courses, along with whatever other courses they have registered for. And I would say it's really more semester specific. In that junior year, first semester is generally when we see students are reaching out for more services, making decisions about how to best manage their time. And that's what I would say, more so than a specific course.
Possible. Samira asked a follow-up, if coming in undecided and switching to nursing, could they still graduate within 4 years by summer courses and everything? I would say, again, if you come in, like I mentioned, you did start to work with your academic advisor, make that clear that you do want to go in that direction so you can get set up with some of the prereq courses that we are looking for. I think it could be possible then, as long as you're smart with your courses and your advisor there. One other, can a student take online courses through Neumann over the summer to get ahead?
Yes, we have some students taking online courses, science courses. We have seen that. We absolutely have. And I think it just depends on whether you as a person feel that's important, or if it's more important to kind of take that break from completing your education at a secondary level. I'm assuming that perhaps the person that's asked the question will be graduating soon from high school. I'm not sure. Some people feel that break is really important. But we do have students that come in with either AP credits or college credits. So we do see students now, because this is more common in the tri-state area, where students got college credits through their high school. And that transfer then, those transfer credits just had to be evaluated. And I think, Joshua, I heard you say that you work on that. That's pretty much one of the areas that you work on.
Yeah, I can, any course that you might take outside of the institution, I can make sure to let you know what our equivalent would be. So anything like that, if you're transferring to us as a transfer student or you're taking courses outside, we can certainly look that up in admissions and make sure that you're taking the right course to get credit for the prereq that our nursing department will require. So I think we'll do one last question here and wrap things up for today. Of course, afterwards, I'll go into the ways to get in touch with us for any further questions as well. Our last question comes from Danya and says, is it possible to do the ROTC program and nursing program to have a future career as an Army nurse?
Absolutely, and we've had that, and it's been just wonderful. In fact, I want to say it's about 3 years ago, we had one of our graduates who was commissioned actually right after our pinning service. Yes, we've seen students do that. Yep, it's possible to do that. Yep.
Wonderful. Well, thank you so very much to Dr. Terry Peach. If you do have any additional questions, feel free to reach admissions. You can also see my contact details there as well. Feel free to send any questions to me, whether you're first year or transfer. We'll make sure to get you in touch with the right person. Also, if you are a transfer, you can sign up directly for our one-on-one virtual meetings as well. So we can discuss any of those prereq courses and things like that. And give us a call or email. We are operating as normal as we possibly can. So any email call coming through, we are able to process. Thank you guys so much for your great questions. They were really amazing. And we thank you guys so much and look forward to seeing you on campus soon.
We do. Thank you so much. You were great questions you asked. Thank you, Josh.
Yeah, of course. Thank you so much.